The following special edition of New Day Northwest is sponsored by Seattle Cancer Care Alliance.
It's a new day!
This is New Day Northwest. Now, here's Margaret Larson.
Good morning and welcome to New Day Northwest. It is a startling fact, but last year more than 1.5 million Americans were diagnosed with some form of cancer. That is 1 in every 4 persons in our country. Seattle Cancer Care Alliance is helping more patients win their battles thanks to a unique partnership between Fred Hutch, Seattle Children's, and UW Medicine, providing life-saving treatments and cutting-edge research. Over the next hour this morning, we're going to learn more about Seattle Cancer Care Alliance's collaborative approach to treatment, from the psychological impact of diagnosis to fertility treatments and clinical trials, and even the financial impact on families and patients. We'll begin with the emotional and psychological aftermath for people who are told you have cancer. Treatment can be tough physically, but the stress associated with it can be lessened with specialized psychiatric and psychological care. So please welcome Director of Psychiatry and Psychology at SCCA, Dr. Fann, and his former patient and cancer survivor, Ron Robbecke. It's good to have you both here. Dr. Fann, obviously, we know this is a super stressful time, but oftentimes patients are left on their own to kind of navigate their emotional responses. How does SCCA address this, and how is it integrated into a patient's care?
Sure. So we recognize that cancer affects people in different ways, and certainly it affects people physically, but it also affects people emotionally, psychologically, socially, and spiritually. And unfortunately, most cancer centers don't do an adequate job addressing those kind of non-physical aspects of cancer. And so at the Seattle Cancer Care Alliance, we really feel strongly that in addition to treating the cancer, it's important to care for the whole person. And so our goal at the in the psychiatry and psychology service is really quite simple, and that's to help people get through their cancer treatment as smoothly as possible, and really to help them get back to doing the things that they really want to be doing.
Well, that really speaks to quality of life, right?
Absolutely.
Being able to deal well with treatment and life afterwards. None of that's going to work if you're too stressed or... what are the common things that people go through?
Yeah, so, people with cancer, they, of course, when they go through treatment, there's stress involved, and sometimes that stress can become overwhelming and lead to problems such as insomnia, anxiety, intense fear or panic, depression, even feelings of hopelessness sometimes.
Right.
And so, research has shown that when people have those problems, it often affects their health and functioning, and even their ability to tolerate their treatments.
So it's really important that this be concomitant with the rest of treatment.
Absolutely, absolutely. We really try to make sure that our care is integrated really seamlessly into their normal cancer care.
Rather than waiting until patients are suffering quite a bit. Ron, tell us about how you came to SCCA.
Well, I'm no newcomer to this. It's been 27 years now. My wife was diagnosed with colon cancer in 1991. I was her caregiver till 2000. And about 3 years went by and I was diagnosed with CML.
What is that?
Chronic myeloid leukemia.
Okay.
And I'm from Tacoma, and I went to a small oncologist down there, and he said, oh, they came out with a new drug. It tastes just like an aspirin. Don't worry about it. It'll go away. And, well, then it wasn't like an aspirin. It really knocked you out. And so I thought, man, I've got to go someplace else. Because he spent 10 minutes with me. I get up to SCCA, and there's 2 doctors, Dr. Keel and Dr. Apkowitz. And between the 2 of them, hour and a half, minimum. And at the end, Dr. Apkowitz said, you might want to talk to Dr. Fann. He's a pretty good guy. And I thought, my life's been a little bit upside down for a lot of years.
Right.
And so made an appointment to see him, and that was, I'm not a former patient, I'm still a patient.
Got it.
But it's been 12 years, and it's about every 3 months I go and we discuss my problems, and what he just named, I've had everything, insomnia, depression, and by a variety of different drugs, we've overcome probably 80 or 85% of the problems I was having.
That is awesome
Yep.
to hear. And it also brings up the point that cancer, from the time you're diagnosed and treated, and even if you're in remission, it's not like all of your worries or stress around that go away, right? This is kind of a ongoing situation that you're dealing with.
Oh, sure. The drug I take, it's called Sprycel. It's extremely strong. It's a chemotherapy drug. You take it every day. It doesn't, you got to do it every day. And from about 2 in the afternoon on, my day's gone. It just, you get headaches, you get, just a number of things that happen, and there's no controlling it. It's just such a strong drug, but it does stop the cancer growth.
So what would you say, Dr. Fann, has been most useful in helping you with?
Oh, just sitting down and talking to me, and we're drawing charts about sleep habits, about how to overcome emotional problems, and he's just been great. And I strongly recommend anybody going through this not to try to do it by themselves.
Right, absolutely. This is not a solo journey.
Oh no, it's not. Yeah, you've got to have help.
What do you think would have happened if you had not had access to Dr. Fann?
All that insomnia, all the depression would have just grown. That's a good question, but the drug I'm on was a brand new cancer-specific drug, so I was very lucky I got the disease when I did, because before I got it, people were dying about, you'd last maybe 4 years. So having the drug, having him, has kept me alive.
I am so glad to hear it.
Yeah.
Dr. Fann, there's so much we hear, people never know quite what to say, but they'll say, keep a positive attitude and that kind of thing. That's so easy to say and so hard to do when this is happening to you or someone you love. There is every reason to expect that people need psychological support.
Yeah, even with support from friends and family, people can experience these symptoms and problems, and then also, as Ron mentioned, a lot of the treatments that we give themselves can contribute and exacerbate, a lot of these problems,
right.
And actually add to things like fatigue, concentration and memory problems as well.
So if a person is diagnosed and they are looking for a treatment center such as SCCA, what can you tell us about how this integrative approach helps not only a patient, but a family?
Sure. Because patients' and families' needs really change over the course of treatment, often depending on the type of treatment that they receive and also the problems and symptoms that they're having. It's important to really have an integrated plan that ensures that we can kind of monitor how patients and families are doing and provide a really multidisciplinary approach.
In one place.
In one place. And we, not only are we all located in the same building, but our psychiatrists, psychologists, and clinical social workers really work very closely in collaboration with the patient's medical team and other support services to make sure that we help patients and their families get through as smoothly as possible and maximize their quality of life.
That's awesome. We all, human beings, need backup, a lot of backup. I'm so glad you're doing well.
Oh yes, I am too, and it's it just every day I think, wow, because in '05 I didn't think I was gonna.
Yeah.
After my wife passed away, then my dad, then my mom, my dad, and I thought, boy, I'm right in line,
Well, God bless you, and
Yes.
you went looking for more when
Yes.
you knew that what you first
Yes.
found wasn't
Yes.
enough, which is
Right.
a great point. Thank you both so very much. A cancer diagnosis does not mean that there has to be a future without kids. Up next, we'll explore preserving fertility options at SCCA.